is Rachel Lavoie. I serve as a military liaison with the Georgia Department of Education. I also am a military spouse, and I've been a dependent for over 35 years. So I have a few questions. What are we doing to currently address and recruit providers, not just recruit and retain, but recruit, retain new mental health providers, our healthcare providers, and then because we do have 70% of military families living off post, and I will tell you, I've ran the numbers, I've seen them for the past 4 years, they're going further and further away, which is creating a bigger problem when we talk about where they're having to go. For instance, my home base is Fort Stewart. So we're seeing more and more people move further and further rural, but they don't have access to the same healthcare. Then in that piece, we're running into billing issues. I'm gonna tell a quick story. So my son started having seizures about a year ago. Gone through TRICARE. They came out of nowhere. It has taken him a year to get to a doctor. TRICARE essentially gave him bad credit. They billed him for things that did not happen. I have had to fight them. I've had to ask for a congressional investigation, and we gotta do better. We gotta do better. So in that piece, there was one other question. Oh, what is the expectation of military healthcare today? Because maybe I'm confused about what we're supposed to be getting and what we're supposed to get from that piece. Thank you.
All right, so I will take on, again, unless anybody else on the panel would like to.
I mean, I can't speak from like
I can do the recruit and retain. I'm all over that. The TRICARE, I can take notes and take those back to my colleagues at DHA who run that program. I get a lot of concerns from the field on that, and we are happy to take that back. And you absolutely, our commitment. What should you expect from military health care? I will tell you, when I came in the Army, again, 30 years ago, I went straight from med school into the Army healthcare system on a 3-year contract. I'm gonna put that out there for a minute. It was a 3-year contract. So either I do have horrible math skills, or it has been such a phenomenally rewarding career to care for soldiers and families in a way that I can be proud of, that I've stayed every time. And it is the latter. And because I believe so much in the importance of caring for soldiers and their families, I am working very hard with my fellow Surgeon Generals and at the direction of our Chief of Staff and our Secretary to address some of the shortfalls that you're talking about. So what you should expect from military medicine is that you get world-class care, whether you're here, whether you're on the battlefield as a soldier. I'm gonna be there with you, my folks will, and we'll be here to receive you and recover you. That's what we owe you. Get you ready for the rigors of combat, be there with you shoulder to shoulder, and help you recover if you have an injury downrange. Also, that your families are cared for while you're serving the Army, so that one, you can feel like you're not trading off doing well at your job versus doing well by your family. We absolutely owe families that, and that means access to care. When I came in 30 years ago, I did see the same families again and again. We did have access to care. Healthcare in our United States has changed over that time. It has become a commodity. One of the things I challenge us to do is to rise above that and not be an insurance plan focused mainly, but we are a service. And we are part of ensuring our warfighting capabilities are maintained. Because while all the services, it's important, for soldiers, people are our platforms. And so it is absolutely critical. So you should expect to have timely care, high quality care, and good communications with that. And that is why I would be able to recruit and to retain, because of the ability to care for soldiers and families based on their medical needs, not based on their ability to pay. That's incredibly attractive for people who go into medicine. I have cared for the President of the United States, and I have cared for the very entry-level soldier. And other than making a house call for one of them, same quality of care, same medications available, same imaging available, I challenge you to find another healthcare system that does that. So that's what you expect. We are working through some challenges right now. I'm actually very excited about the opportunities of leadership who is looking to change in a way that maximizes our ability to support soldiers and families. So that is where we stand. I don't think there's any amount of money I can pay you for retention to have people work in a system where they don't feel professionally rewarded. So that's my commitment, to work on that system that is professionally rewarding, and the nice thing, that's the same system that's gonna give you that world-class care.
I think the thing that I would add as a civilian who provides services through TRICARE is that as part of this DoD Child Collaboration Study, we have a great group of other civilian providers. We have Cohen Veterans Network, we have,
Yeah, move the mic closer, ma'am.
we have Cohen Veterans Network, we have the Barry Robinson Center, we have so many of these amazing civilian-based providers who have, you know, raised their hand, not in the same way, but said, you know, I will be a TRICARE provider. And knowing that so many of our military children get their care through the TRICARE market, like sharing our stories and sharing our journey on what it's like to be a TRICARE provider and the pride that it brings, I think that's something that we also can do a better job, because you have a lot of people, particularly in private practice, who are like, I can't make it work, it won't happen, I'm therefore not going to join. So it's not retention necessarily within the military, but it's broadening that TRICARE provider network. So just another
I love
option.
that. That's so great.
Thank you.
To raise up a story about how it is great to be a TRICARE provider.
It is one of my life's honors. It really is. Yeah.